Hello and welcome. My name is Carol Carter, and I am the founder and CEO of Global Minded. We are all about creating a capable, diverse talent pipeline to get more women, people of color, underrepresented populations, any way you can define diversity, into the education, economic mobility, and leadership pipeline. We do this in a number of different ways. One of those ways is every month we have several of these equity events. Like we're celebrating today, health leaders for International Month of Women. We have STEM events, we have events in technology, K-12, higher education, and we have health leaders that gather here the last Monday of every month at this time. So we're delighted that you're joining us. So that's one of our programs. Another thing we have is a newsletter every day where we feature very diverse leaders from all different backgrounds, so that your students who might be first gen to college or minoritized or poverty affected can see themselves in some of the leaders who have overcome the odds to achieve their dreams. We also have programs at different colleges. We work with the historically Black colleges, several of the Hispanic serving institutions, some of the tribal colleges, and then some of the state colleges that have high Pell eligible enrolling student body. Finally, and we're thrilled that we're going to be in person this year. We have an annual conference. We've been digital the last 2 years because of COVID, but this year we'll be in person in Denver. And the opening dinner, the Inclusive Leader Awards, is June 22nd, and the event will be June 23rd and 24th. And on Friday afternoon of that week, we'll have something called the Industry Marketplace Career Exploration Arena, apprenticeship, internship, and job fair. I know especially in the health profession, some of the people you're going to hear from today are doing some really fantastic pathways work. So we're delighted to have everybody joining us. And I will share that 3 of our nurses have their doctorates in nursing, their DNP, and the 4th is a medical doctor who is also faculty at University of Arizona. So we're delighted to have these folks here. They have extensive experience in equity, diversity, and inclusion. Also, they do a lot with border health, global health, and indigenous health, and have really wide-ranging experiences. So we're delighted to be able to meet each of you and look forward to a really wonderful session. So we'll start out, we're going to just go around and have each of you introduce yourselves, and if you can, our audience really appreciates what's your personal story, what's your origin story, and how did you become passionate about this work, and anything else as part of your intro that can give our listeners a better sense of your path, your passion, and your purpose. And let's start with Tarnia, Dr. Tarnia Newton.
Hi, I'm Tarnia Newton. I'm a faculty at the University of Arizona. I'm originally from the Bahamas, but I spent my formative years, my school years in India, in international Baha'i school. And I always like to tell people that because that really shaped my thinking, because there were people from all over the world, all walks of life, all religions. And so it really exposed me to the socioeconomical development side, the cultural side, holistic gender equity, as well as the reality of poverty and the lack of food and housing in certain spaces. But it also exposed me to Mother Teresa's amazing work in Calcutta. And so that really drew me to the health profession in general, just really reaching out, how can I make a difference and how could I be the change?
Erin, thank you for sharing that, Tarnia. Great to meet you. And let's go next to Dr. Timian Godfrey. Welcome.
Hi, thank you so much for inviting us to share our journey, share our stories, and hopefully provide some motivation or inspiration for the listeners out there. So I want to first show gratitude for even giving us this platform to share our message. My name is Timian Godfrey, and I am a proud member of the Navajo Nation and also mixed race with Hawaiian Japanese heritage. So I'd like to start by introducing myself and my clans where I come from. Yat e Timian Godfrey Yinishia, Tlachi Inchle, Narazose Bashashin, Ashehe Dashache, Narazose Dashanale, Agoteo Dene at Aneshle. I just introduced you of my heritage on the Navajo side and where I come from. And again, it's something I'm very, very proud of. I am also a clinical assistant professor, or assistant clinical professor, excuse me, at the University of Arizona in the College of Nursing. I am a nurse by training and have been a nurse practitioner for the past 8 years and work in Indigenous communities across the country in emergency medicine. However, I am a full-time faculty now and really am dedicated to advancing educational opportunities for historically marginalized students and populations to increase health equity and health justice. And I'm excited to share more about the journey because it has not been easy for me. I definitely am someone who has experienced the social determinants and the certain lack of resources that create barriers to education, but through programming and mentorship and people like my coworkers here who really did reach out and give me that hand when I needed it, it's propelled me to where I am today. So I look forward to this discussion.
Thank you so much. And I will also just share before we introduce Dr. Lisa Kaiser that we work closely with Cheryl Crazy Bull with the American Indian College Fund and the folks from AHEC and the White House Department for Native American and Alaska Natives will also are part of our movement as well. So I know that they are very appreciative to hear your story and your path and how their community can learn from that as well. So thank you. Hello, Lisa. This is Dr. Lisa Kaiser, and we're just doing intros and a little bit about your story and what makes you passionate about the work that you do. And so delighted to see you and your amazing colleagues here.
No, thank you. And I don't think there's a better time to have us come together to really talk about health equity. I think the fact that we have all worked together and we've all worked together closely here in the borderlands is something that we are grateful to have an opportunity to share. For me, I think it's just having been born and raised in Arizona and having been a part of this land and grateful for that has really shaped my journey as well. And so I am a nurse. I am a certified nurse midwife. I am a certified women's health nurse practitioner, and I am on faculty at the College of Nursing. And I think our discussions and our conversations around health equity are driven by the fact that health equity comes from the communities, not from us. And so for all of the work that I do in the communities, there is this real understanding that these are the people that are caring for us. These are the people that are driving our economy in Arizona. These are the people whose wisdom and their experience and their connection to the land is going to be the thing that we most need to really address things like violence and climate change. And so this isn't done out of some sense of service or an unequal relationship. This is done from a perspective of mutuality. And so our work is more out of, I was speaking for all of us and I don't have to, but this gratitude every day of the people we get to connect with, the stories they have to share. And at the same time, it's also in real recognition of the systemic injustices and systemic racism specifically that leads to poor outcomes. So I volunteer at the local clinic here, the community clinic that is a free clinic. I also volunteer at our local migrant welcome centers. And it's just the enormity of the injustice that brings us all here today as well. So thank you, I'm glad to be here. We do have some healthcare promoters arriving at any minute. I'm going to have to step off for about 20 minutes to go to meet them. That was not expected for today, but the situation with migration is is more than you can say in terms of what's going on in our community right now.
Yes, and we're just grateful that anyone in the whole health profession could show up with all the 100,000 things you all are balancing. So Lisa, whatever you have to do, everybody understands, and you can jump back in when you're done, but don't worry about that. So Dr. Anna Landau, welcome. So great to see you. And I will tell you, your backdrop looks perfect. So it looks like it's backwards to you, but it's not backwards to those viewing. So you're perfect there.
That's
Thank
great. I've never used one of those backgrounds, so it's a new experience for me. Thank you, everybody, and thank you so much for the invitation. It's a real honor to be a part of this panel. In terms of everything that everybody else has said, I think it is, in terms of my own background, I was born and raised mostly in Tucson, Arizona, but also with a large chunk in New York City. And I think I was really it was instilled in me from a very, very early age that the idea that there is so much in the world to see and explore, and so much inequity in the world. And even though I have had in lots of ways very enormous amount of privilege in my world, in my life, I have had the opportunity to really understand that isn't the reality for everybody. And I think that to be able to see that and to address that in a way that has been in a way that is meaningful and not just perfunctory or superficial, I think has been one of the biggest privileges in my life. I think that I have worked for a long time on border issues and border health, and have only recently sort of stepped back from working in as one of the medical directors for one of the border health shelters here. And I have continued to do, to work on issues of equity and in the work that I do in family medicine. I'm a family medicine physician and working mostly as a hospitalist these days.
Awesome. Thank you so much for sharing that. And I want to just go to our first question, which is to look at when we see young people, the people that we serve, first-gen poverty-affected students, minoritized students, who tune into these, or the people who teach those students, they often don't see people that they can relate to in their faculty. And so they often want to know what drew you into the health professions and what keeps you motivated right now, given all the different things that are going on, challenges that are happening, to show up fully and be the amazing leaders that you all are. So why don't we start that one first with Timian.
Thank you for this question. And it's definitely a complex answer because there are so many facets to us as individuals that influence where we go in our paths. But I think the point to emphasize is don't try to go about it alone, even though you may not have what is typically viewed as resources, as in money or other types of resources to advance your education. There should be a community, a support circle of people, and educators like us who are always willing and wanting to help you. But the inception point for my interest in health professions began as a child. My parents raised me to, I guess, lend into that altruistic helping role. And traditionally, the Navajo people have a wellness philosophy called Hajot. And Hajot means that we promote harmony, beauty, and goodness between ourselves, the land, and the universe, essentially, between all living things. And if we put good out into the world, then that good will cycle back to us. And I think that just naturally led me into wanting to become a nurse. So I started out as a certified nursing assistant working in hospice and realized that I had it's called a scope, a limited ability or limited scope to help people, even though I thoroughly enjoyed it. So then that made me realize, okay, let me see what else I can do for people. So I received an EMT license and started practicing in that role. And similar to that, I wasn't able to do all that I wanted to do. So I then decided to go to college because in high school, I did not do well academically. I grew up in Utah and it's a very homogenous population. And so being very different than the people I was going to school with, I was trying to assimilate myself into the dominant culture, but I think that created inner conflict. And so it resulted in just not doing well academically. And so barely graduated high school and worked as an EMT and CNA for a couple of years and realized life was just harder. There were so many bills to pay. And if I wanted to continue to what I do and fulfill myself professionally, but also do better financially, then I had to go back to school. So went to college, but that meant that I had to fund my college education on my own. So I was working nights, falling asleep during class and not sleeping, but there were particular mentors that really told me, you need to apply for this scholarship. You need to cut back on working because you are investing in your future and your education. So they provided me with opportunities to actually get scholarships. So I was able to cut back on working and focus my studies to get into nursing school. And it was a very competitive program. And so it was something I was very proud of and became a registered nurse. And similar to that, I was working in the cardiac ICU or cardiothoracic ICU with open heart patients, really like that high adrenaline situation. But I thought, you know what, I feel like there's still more I can do for the people that I'm taking care of. So that led me to get my master's degree as a nurse practitioner. And that's when I really discovered my passion for looking beyond the individual in front of me and looking at systems, looking at the trends that I was seeing. For example, in the emergency departments I was working in, there are people coming in with consistently high blood sugars, those levels, and wounds that weren't healing, headaches, eye problems, kidney problems. And when we would engage in more discussion about why they were having these ailments or complaints, then there was that deficiency or that gap in realizing that actually came from chronically high blood sugar, diabetes. And so really making education more accessible and relevant, taking that time to sit down with people, I thought, this is a systems issue. This is something that the systems can help. And I didn't know how to do that. I didn't have the skills to really make change other than those individuals I was caring for. So that led me to go on to get my doctorate degree and really learn about executive health systems leadership, quality improvement on the systems level. And that opened the door to academia. And because I realized that education is a very powerful mechanism to advance health equity. If you think about it, all the health professions that are out there, and if we really want to increase the capacity of our communities, we have to provide accessible education. So that is where I'm at now. And I'm currently a PhD student, hoping to go on the more research end of things and get that skill set to help build more equitable, culturally competent evidence, because a lot of our evidence is not culturally relevant or reflected. So that's my journey.
Well, it's fabulous. And I think so much of your journey and all the different obstacles and challenges that you've faced have made you so much more aware to have a systems lens than if things had been a lot easier for you. I don't think you'd be helping people in the way that you are now. So why don't we go to Lisa next, because I know she might have to jump out, and then we'll keep going. Lisa.
I think Lisa actually jumped out and then she was going to come back in.
Okay, great. All right. So perfect. So maybe we'll go to Tarnia and then we'll come to you, Anna.
Well, I think I kind of echo what Timian said, and it's, a lot of times the road cannot be easy, and it's similar to what you said, Carol, in the sense you've had these experiences and it helps you with a skill set of resilience. And a lot of times when you come from populations underrepresented or various struggles, you create an amazing skill set of resilience. And resilience plays a very important role when it's navigating various systems. And that in itself will, I would say, let's say, for example, the resilience will actually, let's say, help you in the sense of being able to reach out, being able to, in the sense, in Timian's case, mentors. And because a lot of times that's very important. Mentoring is extremely important. And sometimes we can be timid in the sense and not wanting to reach out because resilience says, I can do it by myself. But in reality, we should look for mentors that can assist us to help navigate these unjust systems at times. And because they're systemically skewed, a lot of times we need those mentors to assist us.
Absolutely. And I think that that whole ability to self-advocate, to understand that you deserve to have resources, you have the voice to get those resources, you can get a strong network of people who can help you, and you deserve that. And you certainly deserve that from your college or your institution or wherever you're getting badges, credentials, whatever you're doing. That structure needs to be able to provide that for students. And I think that's often part of the hidden, the hidden things that students don't know. So thanks for sharing that. And Anna, how about you for this one?
Sure. And so I would echo what both Tarnia and Timian have said. I think mentorship is a huge piece of making, of moving forward and getting to be where, in the positions that you want to be in. And I think there's something to be said, Timian talked a little bit about her journey and sort of, when she's found places that she didn't, she sort of barriers that she wanted to go forward, and how she was able to move forward with that. I think that similarly, I think that I have, been able to have found those, those points. And I think for me, it's been a little bit of a different route, obviously, because we all have our different routes to get here. But I think one of the things that I would really highlight is both mentorship and allies, and I think, and when I say that, I mean, allies in terms of learning and in terms of support and in terms of figuring out, what else, what sometimes it's finding the people to help you understand what you don't understand or what you don't see in the system. And that's I think as much of as important sometimes as some of the other aspects. And I think, and in saying that, I mean, when we don't know what we don't know where to go from there, right? I think, I have very, very early on, I was, very, very consistent that I wanted to do medicine. I was very, it was very clear that that was what I wanted to do. But I think I always saw it as a, person to person, like an individual, right? You're treating an individual, and I think it wasn't until was actually, it was right around the time that I was in undergrad, and I was sort of trying to look at, I was volunteering, and I was seeing the individual, patient relations, which was, of course, wonderful and helpful, but it didn't address any of the systemic problems, right? And I think realizing that so much of the systemic issues are what create the barriers in this work, in this world. And I think that was part of what drew me to do a dual degree in public health. And so thinking about what else you can incorporate. And for me, that was, looking at policy and looking at structures and trying to figure out how do you address those inequities in a larger sense, right? It's one thing to see, the individual and the patient, day to day, but it's a different thing to step back and really look at it from a larger perspective. And I think that was, and to me, what the reason I go back to the ally, and I know ally is sort of a weird and loaded word in some ways, but I think the reason I say that is because, I think for me, it was learning about all of those pieces and seeing those things that I hadn't necessarily always seen before.
Well, and what I love about all of you is you're all cross-pollinators, and you're not just in a narrow kind of silo doing your work. And I think just, having the lens of public health, and that informs so many other ways for you to understand how communities work together and support each other. And I'll say that while we're celebrating, everybody this month and all the programs we're doing and our newsletter, women, that we also have to be able to work effectively with men to teach them and share with them the kinds of things we need to be able to thrive and to do a great job in the roles that we play too. And so I think that's also, you know, part of this bigger web when you talk about allies, that we need to, you know, we need to enlist men to help us as women to be able to do more and to have more doors be open, and then also have that consciousness be raised. So, all right, and I think Lisa is still on her her commitment, so she'll be right back there. But we're going to go ahead with our next question, which is, what are the biggest equity issues that you see and you face in the role that you have, and how do you deal with those things? And we'll maybe we'll just kind of go in the same order, and then when Lisa comes back, we'll have her go through each of these things. So we'll start with Timian, and then we'll go to Tarnia, and then Anna.
So I think I've alluded to it a little bit beforehand, but there are two primary issues that I can see that we need to address as society when it comes to equity. And the first I can think of is education, is really increasing the capacity of our communities, because oftentimes on the larger academic side, there's grant funding that's provided or a lot of resources that are provided with a preset idea. But I think it's becoming more popular now to have it be community informed, community based, community engaged, because it's really difficult to put together a puzzle piece or build a puzzle piece and then go try to find a puzzle for it to fit in. If you develop that puzzle piece from the beginning, knowing it's going to fit and be meaningful for that community, I think that is the way to really advance health equity. But then also increasing the capacity of that community, because before health equity can be realized, we have to look at health justice. And those are the structural barriers that are in place and the obstacles that are preventing us from moving forward with health equity. So by providing the capacity for the community to thrive and for the communities to have that increased education, then I think we are going to have better informed evidence, better informed curriculum, better informed clinical practice guidelines to really help these populations who are experiencing some of our greatest health disparities. But that being said, not only do we need to open up the doors to education, education itself has to be transformed to be ready to receive students from diverse backgrounds, because the traditional model of education is very much of that power dynamic that exists. And that is not going to, it's not going to cut it essentially. And there's going to be a lot of actual psychological trauma that's provided or given to students if we continue that way. So really opening the equity mindedness of our educators and our education systems, I think, is something that's needed. And then on the user end of things in healthcare system, it's the funding structures. Right now with Indian Health Services, the money that's allocated per person would have to triple to meet those who receive benefits from Medicare and Medicaid. And then I believe almost double to match the same amount allocated for those in the federal prison system. And this is based on a lot of historical injustice, treaties that have gone unhonored. And so we really have to look at equity on the funding side of things and provide equitable resources. Again, if you look at where are the populations that are needing it the most, and how can we reprimand that, or not reprimand that, but prepare that to be just a bit more equitable. So I would say education and funding structures on many different levels.
And probably with both of those, we just need to flatten the hierarchy of the levels and structures that have been there for a long time that are just outdated at a time now where we need to be co-creating the solution with the students themselves. So Tarnia, go ahead.
I really just want to add to what Timian said, education. And when we really think, especially in this country, when we think of just regular school education, it's not equitable because it's based on a zip code. And so when we think about that education is power, and then when we think about our high school education is based on funds from the zip code that it's a part of, is the foundation of our educational system equitable? So that's why it's very important that we change and make basic education just in the sense of the funds to fund all high school education equitably. And I think if we have that major shift where there is equitable high school education, where no child is left behind, or no school district is left behind, or lack of funding, I think that would make a big change. And then also, like Timian had mentioned, and then shifting from that various systems, as well as faculty, in the sense of people from underrepresented groups. But if the thing is, if we shift the zip code or the funding of education, I think we will see a big shift where we have people from underrepresented populations, diversifying all areas of health and other STEM occupations.
Yeah. Thank you for that. And I know if Dr. Monique Butler were leading this session for us today, she would tell the story of how she was valedictorian of her high school class in rural Tennessee, and then went to University of Michigan. And she was in a developmental math class, and she realized, like, my high school did not equal, New Trier or outside of Chicago, or these other places where people from privilege and resources, those kinds of schools, and then also those kinds of families that can get tutors and all kinds of coaches and other people. And thankfully, she's so determined, and she was able to overcome that. But, and she went to medical school, and then she got her MBA. But a lot of people would be blown out of the water just by that first gigantic hurdle. So I really appreciate, both of you and your sentiments on that, because I think it's huge. And if we can deal with that and start to reverse it, you'll have many more people who are able to continue their learnings. Anna, go ahead.
Sorry. So yeah, I think that what both Tarnia and Timian have mentioned, I think, is really important. I think that's, addressing the issues of education, and really, I think it's education, and it's the pipeline of really creating that ability to, or not, the ability exists. It's really the access and the support for people to move into spaces that have historically been really prohibitive and really restrictive. And I think that is a huge, huge issue. I think that if we, looking at all of that, it really is addressing the upstream issues, right? So we're not, talking about the issues of health inequity are really downstream, right? This is the symptoms of what we're seeing with the structural inequities. And so I think that education is one aspect. I think the other pieces are issues of access in terms of access to care, right? So, part of it is, how many times do we see patients or see people who are, if they could only get, the bus ride, or if they could only pay for this service, right? I mean, I can't even tell you how many times I admit people to the hospital for things that are so preventable, and it's not, or discharge them into situations that are really going to really reinvent the exact same situation, the exact same constellation of problems that got them into the hospital in the first place, right? And so I think it's a matter of addressing those systemic issues. So access, yes, to education, access to housing, access to, healthy foods, right? I mean, think about, all of those pieces to me are part of the constellation that create a more equitable society, right? And I think that's that is the ultimate goal, right? And I think right now the system is built to perpetuate inequity. And so we have to really, really break it down and really, really start to chip away at, why is it that, people can only get insulin if they have an insurance company that will pay for it? Why is it that people, need insulin in the first, they can't get the health, the food that they need to be able to prevent the diabetes in the first place, right? Why are there only the green space? Why are there green spaces for and exercise and outdoor spaces in places that are more economically privileged, right? Like those are the pieces that are truly structural that we really, and I think that that's a matter of policy, and that's a matter of breaking down the pieces, like the thinking about like the history of redlining, the history of, of those, the separation, Tarnia talks about education being separated by zip code, and that's absolutely true. And I think it's, education is just one of the pieces that's separated by zip code, right? But I think that all of those pieces, need to be they need to be shifted, and they need to be actively countered. And we have to have, different narratives so that we can start to, because it really is, we're just, just really starting to make these changes, even though people have been starting and doing these, doing this work for a long time. It's the reality is that we're really still only chipping away, and we have a lot of work to do ahead of us.
Thank you for that. Let's go to our next question, which is, what do women in healthcare, like each of you, inclusive leaders, have to teach the rest of the health profession? And we can just go in that same order.
Thank you for this question. I have been thinking about this one because I really do look at it. In nursing, it's a bit of a different profession because it is predominantly people who identify as female right now. And so those who identify as male are considered the minority within nursing. But then I was reflecting back on the history of nursing, it being predominantly women, and also I would say historically marginalized. Oftentimes nursing is looked at as subservient to other healthcare professions. And so I think by being a nurse, I have embraced the femininity that I can bring to care and into relating with others, into what I provide. And I'm not saying other professions don't do this, but I think just based off of my experience, is providing that compassion with the evidence and combining those two together, and really knowing that the compassion is kind of the mortar to the bricks of what comprise nursing. And nursing is very diverse in preparation, meaning that we can become scientists, educators, health systems leaders. There's a bunch of nursing degrees if what you want to do. And being a woman who of a part of a historically marginalized profession, I think again provides that resilience, knowing that there's a certain bar that we always have to meet. I think I'm cautious and careful, but surround myself with other strong women who have broken glass ceilings or broken through barriers, so that I'm able to learn from them. I'm always about learning from my elders, learning from more knowledgeable others, so that I can make sure to build upon what they have accomplished. But yeah, I think just having open discussions like this, acknowledging how history has influenced where we are today, and moving forward more united, is something that I hope I can bring as a nurse, as a woman, as a Diné woman, as a mixed race woman. I think that's something that I can provide.
No question about that. Tarnia, what about you?
I think, kind of echoing what Timian had said, I mean, as women in healthcare, and of course it depends, like when we think of nursing, but when we look at various other areas of the health profession or other areas of STEM where we need more women, because, and we're starting to look at just equity and diversity and inclusion within the STEM realm, or even within art or within architecture. Because when we think of systems, we have to think of them being equitable. They have to be thinking of being just. And a lot of times, if we think of the history of women as being caregivers, as kind of being a lot of times the backbone, I think it plays a lot for women to be at the forefront of healthcare, because we are going to be thinking of the future. A lot of times we're going to be thinking of justice. We're going to be thinking of collaboration. We're going to be thinking of selflessness, and we're going to think of consulting with all parties, because I also think we also need to look at also equality of women and men, and that plays a big role. And unless we have women at the same level, think of a bird. For example, a bird has two wings. One is male and the other is female. And for there to be equality, they both have, for that bird to fly, there has to be equality. So right now, women are not at the level where we should be. And until we get to that level, I think then we will have a more just world. I think you have peace, we will have unity, we'll have all these various things, because if we think as members of the human race, we have a shared identity. But when we think of the soul has no gender. So it's just something to think about.
No, I love that. And I agree. I think many of the qualities that have traditionally been associated with women are the qualities like our nation and our world most needs right now. Collaboration, connection, being able to meet halfway, all these different things that I think are women's strengths and can really help heal the world in a number of different ways right now. Anna, go ahead.
Thank you. So I think absolutely, that Carol, you were just saying that the collaboration and connection, I think are really, really resonate. And I think that's very true. And I think that to me is some of the core pieces of what we can offer and what we need to offer, right? I mean, I think we talked about, the idea of cross-pollinating, and that we really are, we do, and I think, we've all worked together in different aspects. And I think that that's something that's so incredible and beautiful. And it honestly isn't super common throughout our professions, unfortunately, right? We are very siloed in our world. And I think that idea of breaking down the barriers and breaking down those traditional silos and realizing that we are all part of a team and that we all work together and we all bring a million different things to the table that are all incredibly valuable. And I think that I think is a huge, huge piece. And I think that incorporating the patients into that are equally important, right? I mean, I think that, patients are a huge part of the healthcare team, and making sure that they are integrated into their own decision-making, I think is another, really, really important piece. I think about, when I think about, what do we have to offer the health profession, I think, the comment about, I can't even tell you how many comments I have experienced, maybe even on a daily basis, about, they're just little flip moments, right? Where, you get put down as a woman or as a leader, or you're not recognized as a leader. I mean, how many times do you walk in a room and you're not recognized for what you bring to the table? As a leader of a team, I certainly, very often it's the one man on the team, even if it's the student, right, who they turn to, and they think that is, the patients think that's who is the leader of the team, even though, I have much more experience and much more to bring to the team, it's a different world. But I think remembering those pieces, remembering to address them in the moment and not letting them slip, right? I think we're so used to swallowing these little moments that that accumulate, right? These little microaggressions, or little moments that I think it's important to call out, but also to call people in, right? To incorporate. And I think that that's a really important, I really love that phrase, that, instead of calling people out, because people get very defensive and then don't react, right? Particularly kindly or well. I think calling people in and really including people in conversations and really shifting that discourse and bringing awareness to all of those issues, I think is really, really important. Issues of gender, issues of race, issues of socioeconomic differences. I think those are all pieces that I think we really need to address. I think that the other piece, and I think for us as leaders and, in the health profession, both standing up for things that, we experience, but also that our students experience, and really being advocates for them. And I think that that's a really important thing, and trying to figure out, it's not always obvious how do you address those issues, and making sure that the students feel like there's a safe space that they can voice that they're uncomfortable if they've had those experiences. I think that's incredibly important. And the last thing I'll just add is just, that the idea that that we're really treating the whole person, and really, and I think that is, we so often in healthcare see the disease. And I know, nursing has traditionally been a little bit better at this than doctors, but I think that it is something that we really have to remember on every, at every moment, and that when we're prescribing people, medications, we also have to think about, well, do they have the understanding to, and are we explaining it adequately for how they're supposed to take it? Do they have access to get to the medication? Are they not taking their insulin because they don't have a fridge to put it in, right? Like, all of those pieces are really important, and really thinking of and seeing people as a whole and not just of their disease.
Absolutely. I appreciate that. And I think that idea of, the physician or the nurse on the same side of the table as the patient, and thinking through the pros and cons of the different things that could be, the therapy or the meds or alternatives, and to be able to be, like we said earlier, co-creating those solutions. And then that patient's invested, and it's not the old telling model, which we're trying to get, away from, also in education, as well as, in practices like medicine. So here's another question. What do you most want to say to young emerging leaders who aspire to really make a difference in the health professions and be able to lead and have the impact that each of you have had? And we'll start with Timian first for that one.
I think the first thing, so even during this is something that I have to overcome, but being called a leader is still very uncomfortable for me to embrace. It's that imposter syndrome. And I think I can, root it back to my upbringing and just my life and whatnot, but really being open about your feelings or your insecurities with, trusted mentors, finding that person, finding others that you want to learn from. It doesn't have to just be one person. If there's a paper you read and you really like the aspect about a certain research or finding or discussion point, then email them, reach out to them. And it can be tough to do if you're, if that's difficult to reach out, but definitely reach out, learn from others, and know that we need to develop the science behind health equity. We need to develop leaders who have the skill set to measure, and that will then influence policy. So there's still such a great need, and really learning from others and then growing from there and building upon that, I think, is the way to do it. But for those who are already involved in health equity, disseminate your work, talk about it, because we need to build that evidence and really strengthen the science behind health equity and the social determinants, these systems that we need to connect. That's where I see the biggest gap right now.
Thank you. Tarnia.
I just want to add to Timian as well, definitely creating that sense of community, reaching to individuals or mentors if you're passionate and that's what you would like to do. Also in reference to, I think of Mahatma Gandhi, and I think of, if you want, to be the change you want to see in the world. So each of us can be a leader. And a lot of times when we think of leaders, we always might think of formal leaders, but I've always looked at everybody's a leader. No matter what you are, you lead your life, you assist someone. And so I always look at everybody's a leader, no matter what it is. Be it an informal leader, you can make change. And no matter how, it doesn't have to be a big change, because just small pivots of change make a big difference. And sometimes it's the small pivots of change that make a difference. And always be authentic to yourself, because I think even Timian had mentioned earlier that for example, when she wasn't authentic to herself, it did not assist her as in her being her best self. And so I recommend be who you are and be authentic to who you are, because you will be your best self. So that would be my advice.
I love that. And that's probably the best antidote to imposter syndrome, that you just trust deeply within yourself, and all those voices of you're telling you what you can't do, or you can really shed that and step into, that which you're meant to have and meant to be and meant to do. Anna, what about you for that question?
Yeah, so I think that piece about imposter syndrome is really real, and I think we all have experienced it at some point in our lives, or maybe continue to experience it in different moments. But I think probably the biggest thing, and it goes very much along the lines of what Tarnia just said, is, you know, a lot of us don't necessarily fit into the boxes that are prescribed for us, right? I mean, we are, in medicine at least, you know, where it's a very prescripted vision of what you should be and how you should behave and how you should, you know, confront different situations. And that's not always the best answer. And I think if there's anything that I've learned and anything that I would encourage others is that, you know, even if you don't fit into that expected box, doesn't mean that you don't have something to bring to the table and something to offer. And that diversity of experience and different ways of thinking about things is actually what change the system and what make the system better. And, you know, just adhering to, it's very hard because, you know, I think we all feel this sense of failure if we don't fit into those expected boxes, or expected, you know, whatever expectations that we are that are there. If we don't meet them in the ways that we think we should, or that other people think we should, we think we have failed. But the reality is that often that's not actually true, and that those are really false. They're falsehoods, you know, they're false equivalencies, that success is fitting into those prescripted boxes. So I think that's, and you know, that would probably be the biggest thing that I would recommend or would tell students.
Yeah, I love that, because it's that idea that you can be in an expansive place professionally. You don't have to be in a narrow place. You don't have to be in a place that's been defined like this for 200 years or 2000 years or whatever. And that your ability to be fluid, to work with unusual suspects, or we call them uncommon collaborators, these are the things that can like 10x your impact and your outcome. So yeah, I think, and I just think that women, we need to remind each other of those kinds of things, because I think sometimes, you know, one of the things that men do well is they can improv well, and they can have many of them, not all of them, but many of them, just bravado about where they are and what they're doing, even if they may not know what they're doing. And I feel like women have to learn from that. I've learned that, you know, being an entrepreneur, like, wow, people ask for this crazy money and I have a hard time even doing that, you know, and just, you know, the kinds of things that are our strengths and where do we need to grow those other areas ourselves and with our emerging leader base, so that those wings, I love that beautiful analogy of those wings, that those wings are balanced and they're both flying, and that we're also helping, you know, men to balance out and use the best that of qualities that have been traditionally, you know, associated with women, and the, you know, powerful feminine as a healing source, but also as a, you know, source in the world writ large to be able to tackle some of the most major problems and issues that we face. And I think, you know, even last night watching, like, wow, okay, the Academy Awards last night, if you guys saw that, it's like, wow, okay, these people are stressed, these people are stretched, these people are, you know, experience suicide in their own families. These people are voicing these things to us, and they're human, and they are not there just glossing over things like normally you would see this, you know, happen. So anyway, well, I am just so delighted to spend this time with you all, and for all of the people who were part of this. I want to ask anyone who has some questions to go ahead and put some questions for you all in the chat. And while they're doing that, I want to share that this book, and I don't know if it's going to show up here because of my, okay, well, I'll tell you what it's called. It's called Listen, Think, Act. And it's the framework for our conference this year, Lessons and Perspectives on Community Development. And it's all about working with people on the ground, as each of you are, to be able to move those big levers of access and equity. And Agnes Sigoye is from Minneapolis, but works with Jamie Van Leeuwen and Thomas Carell through the Global Livingston Institute in Uganda and Rwanda. And I think there's, you know, so many great things from around the world, from indigenous cultures, from different places, things we can all learn from. And so when we're connected to larger and larger networks, we can, you know, have a lot more resources for the kinds of things that, you know, that we care about and that we need to do and want to do. And that's one of the big messages we have for our, college-bound students or post-secondary students, people graduating from high school, or people who do decide to go to college in their freshman and sophomore year, to realize that there are amazing people like each of you in their networks where they might be going to a community college, or they're going to a state college like U of A, or they're going to a historically Black college or a tribal college. And there are those networks and they can find them. They just have to start with that intention that those people are there for them. And then they're going to start to meet them. And they might be meeting them virtually, or they might be meeting them through the newsletter. And I just want to say it's been so great to talk to all of you and be with you all. And we are going to find a way. And I will say Lisa had a conflict, but she is amazing. And we'll have to maybe have her on in April to share about NCAT and the kinds of really cool things you all are doing there on the border. So tell her not to worry about, super busy schedule, that we'll look at that for the end of April for her. And then we'll figure out how we can bring you all as a team to Denver and participate in our health equity team. And Georgia Benjamin will be here, and several of our national and global leaders who really could learn a lot from the wisdom that you all have to share. So thank you so much. I love that last night, and I watched Coda movie on Friday night, but I just feel like, all these things to say how grateful people in the global minded community are for each of you and the sacrifices that you all make, which are huge every day. And just being as resilient and fortified as you are after probably the hardest last 2 years that you've experienced professionally, which we really are aware of that. So thank you so much for making the time to that. And can you please provide the book name and the author? Yes, it's called Listen. Let me put in the chat. It's called Listen, Think, Act. And this is the theme of our Global Minded Conference, June 22, 23, 24. And it's lessons and perspectives on community development. And the authors are Agoye and Carol. And sorry about that, I'm not the fastest typer here, and Van Leeuwen. There you go. All right, that's there in the chat. Excellent. Well, thank you all so much. And we're going to also reach out. Maddie is our newsletter editor. And April, we feature in our newsletter STEM Stars. And we are really delighted. Oh, Susan Morris, I'm glad she's coming in. She'll be here in Denver visiting us she lives in the Southeast. But we will be featuring remarkable stories of leaders in STEM. And we hope that we can reach out and tell the unique stories each of you had in more detail, so that our students can see themselves in the stories and the path that you've had. And Anna, for you, New York and bridging the bridge to Tucson. I went from Tucson to New York City, so I did the opposite. So we'll have to tell some of those stories too when we're together. So thank you all so much. And thank you for all the people who tuned in today with all that you have going on. We will be sending this link to everybody who registered, and it will also be in the newsletter tomorrow. So we want you to share that widely with your teaching networks, with other college, other faculty, and with people who are in the health professions and the business of health as well. So thanks again to everybody. And you all give Lisa our thanks and tell her we so appreciate she's the Uber connector, and we'll be able to connect her with some wonderful people for April month of STEM Stars as well. Thanks so much, everybody. Great to see you all. Take care. Bye-bye.